The following is a paid program from UChicago Medicine.
On average, every 2 minutes, a woman is diagnosed with breast cancer in the United States. Today on At the Forefront Live, we're talking about the Wisdom Study. It's a national research effort to determine if breast cancer screening can be made better by personalizing each woman's mammogram schedule. Breast cancer specialty oncologists and researchers Dr. Funmi Olopade of UChicago Medicine and Dr. Laura Esserman of UC San Francisco will join us to discuss the study and its goal to enroll 100,000 participants. We will also have physician's assistant Sarah Bezzetta on to discuss breast cancer risks and prevention. And as always, we'll take your questions live. That's coming up right now on At the Forefront Live. And we want to remind our viewers that today's program is not designed to take the place of a visit with your physician. And let's start off with having each of you introduce yourselves and tell us a little bit about what you do here at UChicago Medicine, specifically Dr. Olopade, Dr. Esserman. You're obviously joining us from the West Coast, but let's start with Dr. Olopade.
Thank you for inviting me to this panel. I'm a breast medical oncologist, but my main focus of research is to use genetics to improve care for all women. And I serve as director of a cancer risk clinic where we do risk assessment so that we can really optimize prevention for every man and woman at risk for cancer.
And Dr. Esserman, if you can tell us a little bit about yourself and what you do out at UC, is it UC San Francisco? Is that correct?
University of California, San Francisco, yes.
Yeah.
So I'm a professor of surgery and radiology. I actually direct our multidisciplinary breast program, our breast cancer program, and I am focused on precision medicine approaches to both treatment, screening, and prevention, and really particularly interested in developing clinical trials and ways in which we can take some of the exciting new advances forward and all that we've learned about breast cancer biology and make sure that we can get the right treatment or screening and prevention strategy to every woman at the time that they need it to make sure that over the next 10 years, we really dramatically reduce the chance that anyone will die of this disease.
And that is certainly a fantastic effort. And I would be remiss if I did not say that I think both of you have been on the program before, about a year ago, I think it was. And
That's right.
So we talked a little bit about the Wisdom Study back then, and now we're into it a little bit more. And the goal is to have 100,000 participants in the study, which seems like a pretty tremendous goal. But could you start us off by telling us about the Wisdom Study? And Dr. Olopade, if you can kick us off, and just why is this so important?
Yeah, so October is when we ask every woman to come in and get a mammogram. The reason why Laura and I came together to talk about the Wisdom Study, which by the way means women informed to screen based on measures of risk, is because as a medical oncologist, sometimes we find women coming in with advanced breast cancer even when they have been having their mammograms every year. And then Laura has a different problem where women come into her because they have been overdiagnosed with cancer that would never have killed them, but because they got a mammogram, it led to fear and overdiagnosis. So we know that breast cancer is not one disease, that some women are going to get breast cancer that's very aggressive, and some would get breast cancer that even if they didn't do anything about it, they may die of other causes. But we don't know who's going to get what. And I'm a Black woman. I don't know how to screen, when to screen, what to screen. I just hear that I'm at risk for triple negative breast cancer. So I'm asking myself, okay, when I go in to get that first mammogram, I need to do a little bit more questioning about what's my risk for cancer. And since this is the work that I have done at the University of Chicago for decades, I think it's about time for every woman, when you go in, when you start your screening mammogram at age 40 or any time, the study is open to women from age 40 to 75. And what we want you to do is ask, can I participate in the wisdom study? May I choose a personalized arm or choose whatever I want to do? But let me be part of the solution so that we can know when a woman needs to screen, how they should be screened. And so the study really is coming from California to the Midwest. And I'm very proud that the University of Chicago has sponsored it, and I'm participating in it. And I'm asking all my friends to participate. And because we live in a diverse community, I want Black, brown, white, all women in Chicago to participate, because together we can get the wisdom we need to know when to screen, how to screen, and personalized screening for every woman.
So Dr. Esserman, I've got a two-parter for you, and this is based in part on what Dr. Olopati just told us, and I've never thought of this before, but so you have to, I'm certain what doesn't surprise me is under-reporting or under-reacting, but I had never thought of somebody that might overreact to a diagnosis. Can you talk a little bit about that? And then the second part of the question is, if somebody wants to be part of this wisdom study, which it sounds like a great thing, how do they go about that?
Okay, I'll answer both of those questions. Okay. Yes, actually, overdiagnosis is really a problem because it can lead to overtreatment. Yeah. As Dr. Olopati said, as Fumi said, every cancer is not the same. And if you've got a cancer that's small and unaggressive, you don't need a lot of extra treatment. And some of these cancers, especially some of these pre-invasive cancers, are never going to amount to anything. So we don't want to be doing mastectomies or giving people toxic therapy that they don't need. On the other hand, we want to make sure that we find the people with the more aggressive cancers. And some people get these cancers that come up between screens, and it's not their fault that they come in with a large cancer. It's not because they've neglected, it's because the cancer grew too fast. So is there a way that we can find those people through the study of genetics and looking at breast density, all those other factors that Dr. Olopati was talking about? That's what we're trying to answer in the wisdom study, right? And so the only way to do better is to know better, as Maya Angelou says. And so the only way all of us as women can make the future better is to join together and be part of the study. Women will spend 30 to 35 years of their life doing screening. Spend 5 years with us, help us find those right answers. And this is just the beginning. We not only want to find out when you start, when you stop, how often you screen, but take the first part of that knowledge and then start changing and adapting and making it even more specific and more personalized. So over 30,000 women have now joined the study. We're a third of the way there. So you can be one of the 100,000. Everyone can. Tell all your friends and family. All you have to do is go to wisdomstudy.org. It's that simple. You can do everything online. The only one piece of information we need to know is your mammographic density from your mammogram, if you've had one. We'll get that put in, and everything else you can do from the comfort of your home. And if you think about it, now more than ever, at the time of COVID, wouldn't it be good to know how important it is to go in? That's why, if you know your risk, we believe that it's going to be better. But we're not just doing it, we're testing it so that our results can apply to everyone, so that guidelines can change, so that everyone can have a better option, and that we're not only just screening, we're reaching out to people at high risk to see whether we can improve their chances and decrease their risk. So this is really a very important landmark study that, again, all of us women need to stick together and be part of it. And as Fumi says, we are both participating. So we put our money where our mouth is, so you can do it too. If we all do it, we'll get better answers, and we'll get them much sooner.
So wisdomstudy.org, that's where people need to go if they want to participate in the study. And we also encourage viewers, as they're watching the program, if you have any questions for our experts today, please write them in the comments section. We'll try to get to as many as we can during the course of the show. So 100,000 would be the sample size that you're looking for. And Dr. Olopati, we now know that you're about a third of the way there. When will we know the results or the outcome of the study? This obviously is a multi-year effort.
Yeah, so the reason why we really want to make this a national study, and when my colleague called me, I call her my best science and research partner, Laura. You know, the study and the University of California group, they had organized together across California to really do this study. And so they formed the Athena Breast Network. And then I was thinking, why aren't we doing this in the Midwest? Why aren't we organizing in Chicago? And so, you know, as we have learned through this pandemic, we're all in it together. And by being able to have testing available, by being able to share information that is really important to our health, I think we would learn how to do better with breast cancer. So I totally agree with Laura when she said, look, we're in a pandemic, we're all at home, and we're wondering, oh, well, I don't want to go to the hospital. I don't want to go and get a mammogram, or maybe I don't need it. Well, cancer can be deadly if, in fact, you are at risk for an aggressive breast cancer. So I'm hoping that we will use this opportunity to just say, yes, we can do both things. We can shelter in place, we can wear a mask, we can wash our hands, and then those of us in the hospital, we're ready for you to come in and get your screening. So I know that there may be some women out there who do not have access to the internet. They cannot fill out the form in their own home. Well, when you come into your screening mammography, we would have a kiosk ready for you. We would have a way for you to be able to just put in the information so that we can then begin the process. And that the process will get easier if we can just get all of us engaged in the process. Every woman is at risk for breast cancer. And what we're really asking is, let's all come together and join this study so we can get information that will inform all women, Black, white, brown, women in the Midwest, women on the coast. And I'm looking for all my friends in Chicago to join, as well as all of our patients at the University of Chicago, or the people who work at the University of Chicago, because together we can get the solution that we need.
And Dr. Esserman, you had a comment you wanted to jump in with?
I was just going to say, it's just that easy. If you have a smartphone, go to wisdomstudy.org. That easy, you can sign up. And importantly, you know, we're trying to by random assign people to either the personalized or the annual arm, right? Yeah. But if you feel strongly and you want the personalized arm, or you want to say, oh, I want to get my annual mammograms, please, you can do that too. Just choose, I want to choose my arm. Actually, it's just so simple for everyone to join, but we need everyone then to stay with us and make sure you keep in touch with us and let us know what's happening, because that's how the study works. You know, and again, all of us together, we can make the future better for sure.
Well, it's so important. Dr. Olopati, I appreciate you saying what you said a moment ago. Get your screenings. Even with the pandemic, you still need to get your screenings, and you still need to get medical care, because first of all, coming to the hospital is very safe, but we don't want people to not do those things, because it's not worth it. Get your screenings, you'll be safe. We make sure that people are very well taken care of. So Dr. Esserman, question for you. Now, when we talk about personalized mammograms, what exactly does that mean, and how does somebody get their screening personalized?
Well, so, you know, as Dr. Olopati said, we know that breast cancer isn't one disease, and today we don't treat everybody like they have the same cancer. So it may be for screening and prevention that one size doesn't fit all. Instead of telling everybody, get a mammogram at 40 and do it every year, maybe there are some people who really are at very low risk, and they can start screening when they're 50. But there are other people whose risk is quite a bit higher. And in fact, there's a combination of things that we can learn. It's not only what your family history is and what your and what other risk factors you might have, but we can learn about your genetics. And what does that mean? Just with the spitting in a tube, we can understand what your DNA is made of. We can find out if you happen to have one of the very uncommon, errors in one of the genes that puts you at very high risk for breast cancer. If you have some background genes that, when combined together, really do either increase or decrease your risk, well, we may be able to say, hey, you are really at risk and you're probably at risk for a hormone-positive breast cancer. We have something we can do to help you reduce that chance of getting a cancer. And it's safe, and work with you on that. Maybe if you're very high risk, you should come in, get a mammogram alternating with an MRI every year. Or, and so if you're in that very high risk group. So again, it's about when to start, how often to screen, and with what type of screening you should use, and would you benefit from prevention? And if so, is that prevention working? That's how we're going to move the field forward. We believe that that's better, but we're testing it. We want to find out if it's just as safe as annual screening, if it leads to fewer false positives and scares like Dr. Lopati was talking about earlier, whether women prefer that and can follow that protocol, and whether at the end of the day we do better with prevention. That's what the study's all about. And if we show that personalized screening is a better way forward, we can just continue to make it better and better. That's the way that we're going to, prevent breast cancer.
Yeah.
And death.
And I just want to say that, in October, we celebrate Breast Cancer Awareness Month, but we also remember that there's so many women out there now and living with metastatic breast cancer who are looking for us to get new cures, new drugs, and bring new drugs to help them beat or live longer with breast cancer. So I just want to take a moment to say that because of genetic testing and because of the research that we have done, we have more chances that women will live even longer with advanced breast cancer. And that's why we're really saying, yes, we start with prevention before you ever get that first mammogram. Help us look at when to begin screening or how to screen you. But even after you are diagnosed with breast cancer, we know that using targeted therapy, using genetics to inform how you get treated has changed the games for so many women. And that's why at the University of Chicago, when we talk about being at the forefront of medicine, it's because our research benefits our population, benefits women. And I couldn't be prouder of what we have done during this COVID, because we know, yes, if you get COVID, you're more likely to die if you're Black or brown. But guess what? If you have the right medication, if you get into the right clinical trial, you survive. And so beyond COVID, we're talking about survivorship, giving yourself a chance to have early diagnosis. And the only way that we get that is when you go in, get your mammogram, and get good doctors to take care of you.